Aloha, everyone, and welcome to the SEOW quarterly meeting. My name is Laura Johnston, and I'm a Policy Research Associate on the State Epidemiological Outcomes Work Group team from the University of Hawaii at Manoa. We hope everyone's having a great week so far. To start off the meeting, we will introduce our speakers and have a quick overview of the agenda. So we'll start off with a welcome and overview of the Hawaii Strategic Prevention Framework Partnerships for Success project and the State Epidemiological Outcomes Work Group. We're excited to have Dr. Samia Amin, postdoctoral researcher from the University of Hawaii Cancer Center, present on vaping cessation, a global and Hawaii-centric perspective. Samia is a pediatric hemato-oncologist by practice and public health researcher by training. She has more than a decade of experience in teaching clinical epidemiology in different countries across the globe, namely in Bangladesh, Malaysia, and Australia. Throughout her clinical career, she was actively involved in a range of primary care, preventive, and health promotional activities. She has a specific interest in tobacco informatics, addiction medicine, and cancer epidemiology. She has a broad set of skills in research across both qualitative and quantitative methods, and she's currently working as a postdoctoral fellow with Dr. Pallav Pokhrel on multiple projects involving e-cigarette epidemiology and prevention strategies. This presentation will be followed by a brief Q&A and a 10-minute break. And after the break, we'll have Kara Saiki, Master of Public Health and Junior Specialist, and Nicholas Bonifacio, Project Coordinator with the Office of Public Health Studies at University of Hawaii Manoa, present on reducing underage access to tobacco in Hawaii. Since 2022, Kara Saiki has served as the principal investigator for the tobacco state contracts aimed at reducing underage youth access to tobacco. Her interests lie in analyzing the trends of tobacco sales to underage volunteers across the state and what factors influence noncompliance rates. Other interests include evaluation work focused on preventing chronic diseases, including diabetes and hypertension, as well as advancing health literacy. We will also have Nicholas Bonifacio, who's been working for the 3 tobacco projects, Project CATS, CINAR, and FDA Tobacco, since 2012, and became the project's coordinator in 2022. These projects are aimed at reducing underage access to tobacco. His interests include health literacy, health determinants of health, and cultural competency in healthcare. This presentation will also be followed by a brief Q&A and closing remarks. All right, so let's begin with an overview of the Hawaii Strategic Prevention Framework Partnerships for Success. The SEOW is part of the Hawaii Strategic Prevention Framework Partnership for Success, or SPF-PFS, which is a federal grant funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. And the purpose of the SPF-PFS is to strengthen and enhance Hawaii's prevention system to promote well-being and reduce the impact of substance use in Hawaii's communities. The SEOW is a partnership between the Department of Health, Alcohol and Drug Abuse Division, or ADAD, University of Hawaii, and interested community stakeholders. The SEOW has been providing epidemiologic services to ADAD since 2006, and the SEOW collects, analyzes, and reports substance use incidents and prevalence, as well as provides technical assistance and training for state and community stakeholders. The SEOW comprises of researchers, epidemiologists, data managers, and other professionals involved in research, data collection, and utilization pertaining to drinking and substance use. And the SEOW core team also produces the Hawaii State Epidemiologic Profile for Alcohol and Drugs, using the latest available data from diverse data sources to profile the current substance use situation locally. And we also conduct these quarterly meetings where individuals and organizations have the opportunity to share their substance use related data. So that's a quick background on the SPF-PFS project and the SEOW. And there are just a few reminders we want to go over before getting started. So we are using a Zoom webinar format, which may look a little different from the Zoom meetings format that you may be used to. Attendees are muted and videos are off, so presenters and hosts are not able to see attendees, and attendees also cannot see themselves. So if you have questions, please send them through the Q&A feature located at the bottom middle of your Zoom window. And you do not have to wait until the end of the presentation to submit your questions or comments. please send them in at any time and we'll review them at the end of the presentation. And if you would like to wait until the larger discussion at the end of the presentation, that's also totally fine. So without further ado, I'd like to hand it over to Dr. Amin.
Hello everyone and good morning, and I thank you everyone for joining this webinar. So can you see my slide? Okay, so today I'm going to present about electronic cigarette uptake and cessation. And as already introduced, that I am a medical doctor. I am practicing pediatric hemato-oncology as a trained medical doctor and also a public health researcher by training. So for the last 5 years, I have been conducting research on electronic cigarette use among young adults that dealt with the understanding of the social and cognitive factor associated with the e-cigarette uptake. And currently, I am with my research team, those who are working in University of Hawaii. Sorry, can you see my screen? Hello, hello, can you see my screen?
Yes, we can see it now.
Okay, so currently I'm working as a postdoctoral fellow with Dr. Pallav Pokhrel, who is a behavioral scientist and also very well-known tobacco policy-related research work. And I am worried that the rapid increase in the electronic cigarette use may undermine the progress that the public health community and government has made over the decade to reduce the addiction to nicotine. Thus, I'm highly motivated to develop and test electronic cigarette-related use cessation program. So in this presentation, I will present the vaping prevalence trend as well as the vaping cessation and what is happening in the social media and evidence from our current research project related with the vaping cessation, including the social media and the digital technologies and their impact in the vaping cessation process, and what are the available vaping cessation program globally throughout the United States, as well as the highlighting in Hawaii prospect and also our future research agendas. A little bit background about the electronic cigarette. Electronic cigarettes are the product that produce aerosol by heating the electronic liquid. We called it e-liquid, and it usually contains nicotine, which is the most addictive substance in the tobacco. And it was first marketed to serve as an alternative to the conventional smoking, like regular cigarette smoking. And many individuals actually choose to vape, that means the using of the electronic cigarette, as a way of transitioning to become a non-smoker. But there has not been any conclusive evidence regarding the vaping as a smoking cessation tool. And the United States Food and Drug Administration has not approved any kind of electronic cigarette as a quit smoking aid. And evidence also suggests that electronic cigarettes are associated with the respiratory cardiac disorder as well as depression. So in the global market, almost 90% electronic cigarette products sold globally from China. And between 2014 to 18, the value of global electronic cigarette market has been doubled, which means in United States, it was 6.8 billion in 2014, which became 15.5 billion over the 2018. And it has been estimated that in 2021, it had already increased almost $22.8 billion. And most of the North America is the largest electronic cigarette market, which is actually 7.8 billion in the 2021. And Western Europe is the second largest global market, where the estimated market value is 6.5 billion in 2021. There are different type of electronic cigarette, and we called it like by generation. For example, first generation is the disposable one, which is the very unique uses, and second generation is comes up with a battery and also refillable cartridge. The third generation is actually refillable cartridge with a chargeable adjustable voltage, and as well as the customization of the substances, that is the electronic or e-liquid. And the most latest version, which is called fourth generation, are very different size and shapes and colors, and they have like adjustable airflow and also very temperature sensitive. They are comes up with the various different type of colors and shapes. So the fully disposable electronic cigarette, which is the first generation, is now dominate the market in the United States. And the unit share of pre-filled tank, which is the second generation, actually decreased 75% to 48% within the year of 2022 to 2022. But the disposable electronic cigarette use actually increased from 20 to 24.7% to 51.8% over this period of time. And the sales of nicotine strength in the electronic cigarette are now also dominate in the United States market. So both the disposable electronic cigarette and pre-filled cartridges all increased in nicotine strength from 2017 to 22. That means over the year of 2022, nicotine strength has been more than 5% in both disposable as well as pre-filled cartridges. So a little bit prospect from the Australia, which is the first country in the world. From October 2021, a prescription is required for all type of purchase of nicotine vaping product, which include the nicotine electronic cigarette, electronic pod, nicotine pod, liquid nicotine, and these all includes the purchase both in Australia and also imported from the overseas suppliers. And since May 2023, due to the growing youth electronic cigarette epidemic and concern about subsequent transition to combustible cigarette and also an extensive public health consultation process, Australia, as I mentioned, the Federal Health Minister announced the first world ban on non-prescription vaping product, which is actually recreational vaping product with all kinds of flavors. So the importation and sales, that means both importation and sales of all different type of electronic cigarette, regardless of whether they are labeled as a containing nicotine or not, they are banned in Australia unless they are supplied by a prescription which has been given through a licensed pharmacist. And this move also includes a ban of all single use of disposable vapes. That means at this moment, all different type of disposable vaping products are restricted, including any type of flavors, and they are also shifted to plain packaging and a reduction in the concentration and volume of nicotine that are permissible in the devices. So now I will give a little bit of background of the prevalence of the vaping. Currently, 82 million vapers are in worldwide, and you can see United States is the second largest vaping prevalence at this moment. So this is a comparative analysis of the electronic uses across the United States in different states. And you can see in 2017 and 2018, the red mark are the highest prevalence rate of vaping cessation in the states. And Hawaii is included in the highest rate of vaping cessation, which is actually more than 7% and 7 to 10% of the vaping prevalence. So Hawaii is the one of the most high prevalence vaping cessation in the United States. So this is the data from the behavioral risk factor surveillance system, and 2019, 2020, and 21. So before COVID and after COVID, also the prevalence of the vaping cessation is also higher in Hawaii. We can see a little bit of decline in 2022 due to the COVID, which is 6.7, but immediately in 2021, it has been increased 4%, which is very concerning. So in United States, 1.6 million high school and middle school youth report use at least 20 days a month, which is 34% high school and 80% middle school electronic cigarette user. That means 1 out of 5 high school electronic cigarette users reported daily use. And youth who have electronic cigarette has been unwitting casualties in the outbreak of the electronic cigarette or vaping product use associated lung disease, which is called EVALI. And that has been occurred in January 22, and which result 2,711 confirmed hospitalization cases with 60 deaths. Based on Hawaii Youth Risk Behavior Survey data, the middle school and high school student who used electronic vape product, including all e-cigarette, e-cigars, e-pipe, vape pipe or vaping pen, e-hookah and hookah pens from different companies, the overall prevalence is 13.4% and high school is 23.4%. Although from 2017 to 2021 data shows that there is a declination of the electronic cigarette, but overall higher than the national average. So the rapid increase of the EVALI and youth use of the electronic cigarette, the federal government to enact the stricter provision on tobacco product. At this moment, the legal age for purchasing the electronic cigarette since January 2022 is raised from 18 to 21. And in Hawaii, the electronic cigarette are the only subject to general excise tax, and licensure and permitting are not required of the vendor. And this type of lack of regulation leaves youth vulnerable to easy accessible and highly marketed, which is above $9 billion marketing dollar of the product. Okay, so now I will discuss and highlight about what is happening in the social media related with the electronic cigarette. So I'm not sure whether you guys know this man, a guy whose name is Austin Lawrence. These are his verified profile in Twitter as well as in Instagram, who has only 37 videos with 3.4 million subscriber and also 2.1 million subscriber, 1 million follower in Twitter. Okay, so what is happening or what he is doing in the social media? Let's have a look. So isn't it cool? Because this type of video post and also social media influence may attract the young generation. So my supervisor, he conducted a social media electronic cigarette exposure and e-cigarette expectancies used among the young adults, and data was collected from the young adult college students in Hawaii, and which has been published in Addictive Behavior, and the result shows that the social media electronic cigarette exposure was associated with the current electronic cigarette use indirectly through positive outcome expectancies, namely from the positive smoking experiences. So we conducted another study where we found that the electronic cigarette advertisement exposure, celebrity endorsement, and social interaction and social norm of the family, friends, and peers also increased the intention to use electronic cigarette. So based on the Hawaii Youth Tobacco Survey data, 2017 to 2019, you can see there is an increase of the use of electronic cigarette among the high school and middle school due to the use of electronic cigarette because of the famous people they use them, which is actually celebrity endorsement. Another study conducted by my supervisor and his team, where they actually collected data from the multi-ethnic college student in Hawaii, and the result also shows that the e-cigarette marketing was associated with the perception that e-cigarettes are less harmful than cigarette, which in turn was associated with the higher recent e-cigarette use. Another focus group study where data was collected from the 62 young adults in Hawaii, mainly from the Oahu, and through this focus group study, they have found what are the reason of liking electronic cigarette and what are the not liking the electronic cigarette among these groups of people and the groups of students in adult young in Hawaii. So the recent study, which has been published in 2023, the longitudinal data also collected from ethnically diverse young adults who reported current use of electronic cigarette in Hawaii indicated the lower likelihood of the electronic cigarette discontinuation was associated with the baseline factor like higher e-cigarette dependence, longer history of e-cigarette use, and lower e-cigarette harm perception, open pod-based device, and throat it like a health reason. So that means that the recent year, the different type of populations or young adults and Hawaii populations are interested in the vaping cessation or electronic cigarette use. Let's focus on the Twitter study. In our Twitter study, we also evaluated what is happening related with the vaping cessation in the Twitter. Twitter is also a great platform for some important tobacco-related research team. For example, the NCPC, which is the Nicotine Cannabis Policy Center in California, they tweeted some post with the emoji or GIF that related with the vaping cessation. Also, the Tobacco Free Australia, which is also another important platform, they also posted some tobacco or vaping cessation related posts in their Twitter. So our paper has been accepted in the American Journal of Health Behavior, where we explore vaping cessation related posts, especially the hashtag vaping cessation, quit vaping, stop vaping in Twitter. And we did a sentiment analysis, and 6 different themes has been emerged, especially what are the support for vaping cessation, what is the promotion, barriers, benefit, personal experiences, and also the usefulness of peer support for vaping cessation. This is an example of one of our theme, which is the quit vaping support, and the sub-themes you can see, we found that quit coaching, medication references, reward system, use of digital technologies, and navigating the website for quit services and quit line assistances. We also explored the TikTok, which is also a great platform, which has like 834 million users across the globe. And the most users are from a very young age, like 10 to 19 years or 20 to 29 years. And United States is the highest TikTok audience, which is 136 million. And surprisingly, all the 3 top most earning in 2021 are from United States. So we feel that it's a very important platform for us to evaluate or access or understand what is happening related with the vaping cessation in the TikTok. So let's watch 2 videos to understand what is happening in the TikTok.
You happen to vape by chance?
Yeah,
How long have you vaped?
a good 6 years.
Have you tried to quit before?
Yeah.
Has anything worked?
No,
What strategy have you done in the past? Anything creative or just cold
Yeah.
turkey?
I actually quit and then I started smoking cigarettes once a day and then that turned into like a pack a day. So then I went back to vaping. I just quit cold turkey. It made me feel nauseous. I don't like vaping. The juices, all of it. I was like, I can't do it anymore. But I smoke cigarettes.
How about you?
I hit my boyfriend's neck. That's about it.
Is there anything ridiculous you would do to be able to wake up tomorrow and you're no longer addicted to nicotine?
Yeah, but it kind of depends.
Have you ever dropped your vape on the grounds and then continued to?
Yeah, one time this crazy dude with a metal rod and he was like freaking out just outside some bar and he grabbed my vape out of my hand and chucks it across the street and yells, "I'm gonna shoot up this place." And my reaction was to run and find the vape.
So let's watch the second
If
video.
there's a better way to quit vaping, would you do it? Did you know that 95% of people who start vaping, cold turkey doesn't work for them?
Well, I'm that 5%.
What would you recommend for quitting?
Chewing gum and lollipops and like Jolly Ranchers, so rot your teeth instead.
So the first video actually highlighted the young generation transit from vaping to cigarette, which is traditional cigarette, and also talk about how much crazy about the vaping product. And the second video also talk about the vaping cessation process.
If there was a bet.
Okay. So we also evaluate the TikTok and we explored top 100 TikTok video related with the hashtag vaping cessation. And we included 87 videos for the final analysis, and which has 105 billion views, 9.6 million likes, and 57,000 shares. The analysis actually revealed 9 emerging themes and motivation, barriers, and use of the A's and common relapse experiences, identity, self-images, celebrating success of cessation, emotional journey, and so on. So this is a glimpse of my motivation of the quitting vaping, which is the first theme, and it has been highlighted 2 different concerns, which is health concern and as well as the financial reason. We also explored the digital platform. So we find that the 4 different type of vaping cessation mobile applications are available in ISO. We did not explore the Google Play Store, but this is the highlights of the first like quit vaping, which has a highest ranking. 8.9K was ranking, and it was ranked as a 4.9% out of 5. They have very cool feature like ready to quit vaping, buddy system, vape tracking system, their community, their claim process, account process, their goals, and so on. We also explore what are the text messaging process or text messaging services. We found that the Truth Initiative, they have their own text messaging program, which is This Is Quitting. With this motive, we actually explored we conducted a systematic review, and we find what are the experimental and longitudinal studies are related with the electronic cigarette use cessation. So we find that the mobile application and text messages were the most common intervention tool for vaping cessation, and AIM Health Technologies tend to promote vaping cessation outcome. And the longitudinal studies, they highlighted the demographic factor like gender, race, and ethnicity, vaping frequency, and smoking status predict the vaping cessation outcome. We have also explored what are the AIM Health applications are used for intention, attempt, and abstinence of the electronic cigarette. And we find that the text messaging, mobile app, telehealth platform showed AIM Health intervention increased the intention to quit electronic cigarette, also prompted more quit attempt, and improved the e-cigarette abstinence. And cross-sectional studies highlighted the substantial interest in AIM Health services for the e-cigarette cessation. We also explored the artificial intelligence platform for the vaping cessations using the recent ChatGPT platform, which has been published in Tobacco Control, and we actually 10 real world questions about the vaping cessation were selected from the Reddit forum randomly, and used the ChatGPT as a prompt, and themes related to the vaping cessation support were identified, like understanding what is nicotine withdrawal symptoms, self-regulation process, peer support, motivational support, and nicotine replacement therapy. So it highlights that if we managed by a group of experts, including the clinicians, behavioral and computer scientists, and AI, that means artificial intelligence platforms such as the ChatGPT, may be leveraged to design tailored intervention for tobacco use cessation, including the vaping cessation. So vaping cessation, that is a Hawaii youth tobacco survey, they have showed that 57% middle school and 60% high school students try to stop or want to quit smoking or vaping, but there is need to improve evidence-based cessation program to increase quit attempt and successful cessation among these youth and young adults. So across the USA, nationwide, there's a 2 program, which is Stanford Tobacco Prevention Toolkit and Catch My Breath e-cigarette educational program. So Stanford Tobacco Prevention Toolkit is a free online resource. They aim to prevent tobacco use among the middle and high school students. And this is a real-time multiple interactive format of quizzes, fact sheet, activities, and presentation. Since 2016, it has been like 8 million page views, and mainly the toolkit is delivered by the trained educators, and 4,750 educators are at this moment enrolled, and they reach estimated 1.3 million and 1.8 million youth in 2022 and 21 respectively. And the Catch My Breath program, which is coordinated approach to child health program, is also a support vaping prevention that provides students with the skills to resist peer pressure and media influences to try electronic cigarette. And since June 2022, approximately 4,000 schools in the United States have adopted this program, with 70,000 teachers have taught the program, and 1.4 billion students have been exposed to this program materials. So in Hawaii also, we have like My Health, My Quit promotional resources. It's a text messaging services which is started with the Start My Quit. And also we have like My Life, My Quit program just for teens under the Hawaii My Life, My Quit organization. And also we have HawaiiNoVape.com program, which is support educator tips and also the parent tip. So based on the Hawaii Tobacco Prevention and Control Plan 2023, the BURFERS data shows that the overall 69.9% adult in Hawaii know about the Hawaii Tobacco Quit Line, but only 17.1 adult use the Quit Line program or counseling or medication to quit in the past 12 months. And 4.7% tried to quit in past 12 months using a cessation class program or support group. So Native Hawaiian often access the cessation service to the Hawaii Tobacco Quit Line or Native Hawaiian healthcare system, regional community health centers, or any other that program offer individual or group counseling session. And Hawaii Tobacco Quit Line reported that 27% of the caller, they are identified themselves as a Native Hawaiian or part Hawaiian. And Hawaii Tobacco Prevention and Control 2030 identified the long-term measure to demonstrate the improvement of the tobacco prevention and control. So based on their plan, the long-term measure is, for example, the current e-cigarette use among the middle school teens. The baseline prevalence is 17.7% based on the National Youth Risks Behavior Survey, and they target to reduce it as a 10.5%. Same for the high school, which is baseline is 30.6% and targeted 10.5%. And middle school who tried to never tried electronic cigarette at this moment, based on 2019, the baseline is 69.4%, which has been targeted to increase 70-70%. For high school is also targeted to increase from 51.7% to 57.4%. And most importantly, the adult awareness of Hawaii Tobacco Quit Line services is based on 2018 data. BURFERS data is 72.3%, which has been targeted to increase 81%. So our next research agenda is to develop a culturally tailored vaping cessation pharmaceuticals or pharmacological intervention program, and also smartphone mHealth application development to evaluate the feasibility, acceptability, and preliminary efficacy of vaping outcome. And we believe that such tailored initiatives for Hawaii young adult might help to improve the underserved group bearing a disproportionate burden of vaping-related risk. And the knowledge we will generate will be invaluable in guiding the culturally tailored mHealth tool for diverse population facing the similar public health challenges. Okay, thank you.
Thank you so much, Dr. Alman. We're now going to move on to questions. If you haven't done so already, please submit your questions or comments that you have about the presentation using the Q&A feature, Zoom chat, or you can also raise your hand.
Hi, I may have missed this, but regarding the Hawaii Tobacco Prevention and Control Plan for by 2020, I'm sorry, 2030, why are we using national YRBS data and not Hawaii, the state data for this for Hawaii?
Okay,
I'm just,
good
I'm,
question.
yeah, I'm just trying to figure out, because if we're trying to prevent e-cigarette use in Hawaii, shouldn't we be using the Hawaii state data?
Thank you so much for the question. It's a very good point why we are considering the national prevalence rate to improve, because at this moment there is not available data for the Hawaii perspectives. We have gathered the births data. We are also planning to develop that means publish the new released births data prevalence and rate and proportion rated. We are working on it soon. If it is available, we will share with the we will publish and we will share with the relevant bodies. If we cannot find the relevant data, then we will consider the national data. I will highlight this question with my supervisor, and then we will think about it in future. Thank you so much.
Thank you, Doctor. I was just wondering, because how are we going to, if we use the national data, how do we know that the efforts we're doing here in Hawaii
Okay.
is
Overall,
is resulting in that percentage change? Does that make sense?
yes, of course. I will let this question and discuss definitely with my supervisor. As I said, that we already gathered the births data, and I'm working on like since last year, August. So we are working on that, and then once we find the available information, we will definitely discuss with the relevant bodies to find the way of making the standardized process in the Hawaii. So there is one comment. One of the most frightening fact in the high use of vape cartridge and or liquid for inhalation in 2022, Hawaii cannabis dispensaries sold over $22 million in vape liquid. This is out of total sales figures of 64.5 millions. Yes, I agree with you. And this is really frightening. We are also considering, we are also conducting some research related with the cannabis dispensaries. And if we have any recent relevant data, we will definitely share with you. Well, I guess there is no more question. And
Yes, thank you so much, Dr. Ahmed, and thank you for your questions as well. We are going to have a 10-minute break to give us time to transition to the second half of the meeting. So feel free to stretch, relax, get some water, and we'll see you back here at 10:50.
Is it okay if I just leave it up, or do you want me to take it down until we start up again?
Maybe just take it down for now.
Okay.
All right, welcome back, everyone. We're about to begin the second half of our quarterly meeting. So please join me in welcoming Kara Psyche and Nicholas Bonifacio.
Okay, let me share my screen. Wait a second. Okay, can everyone see? Okay. I take that as a yes. Okay, great. Good morning, everybody. My name is Kara Psyche, and I'm here with my colleague, Nicholas Bonifacio. We're out of the Office of Public Health Studies at the University of Hawaii at Manoa. And we are responsible for conducting the underage tobacco sales compliance checks for the state of Hawaii. So today we'll kind of be going over, giving you an overview of the tobacco enforcement laws, and then we'll go into each of these projects in a little bit more detail. So I'll let Nick take it away first.
All right. Hi, good morning, everyone. So we're going to begin this presentation by just listing the types of tobacco products that our projects are concerned about. So these are the types of tobacco products that our projects ask for when we do our purchase attempts with our volunteers. So they are cigarettes and cigars, electronic smoking device or ESDs, electronic nicotine delivery systems or ENDS components such as e-juice and pods. We also ask for different types of other tobacco products, such as pipe tobacco, smokeless tobacco, hookah, and chewing tobacco. And then I'm going to quickly go over the different federal tobacco enforcement laws and later on talk about the Hawaii tobacco enforcement laws. So in the federal level, there are three main tobacco enforcement laws. The first one was enacted in 1992. It was called the Signer Amendment. This was aimed to decrease underage access to tobacco products. And then in 1996, the Signer regulation was passed. This is aimed at states to enforce underage tobacco access laws and to conduct annual unannounced inspections, hoping for a non-compliance rate of no more than 20%. And then later on in 2009, the Family Smoking Prevention and Control Act was passed. This granted the Food and Drug Administration, or FDA, authority to regulate the manufacture, marketing, and distribution of tobacco products to protect the public health generally and to reduce tobacco use by underage youth. A little bit more detail about the 1996 Signer regulation. Again, this is on the federal level. This was issued by the Substance Abuse and Mental Health Services Administration, or SAMHSA, to provide guidance to all the states. Under this Signer regulation, it enforces underage access laws to a degree that is reasonably can be expected to reduce the illegal sale of tobacco products to individuals under the age of 21. It also asks states to conduct annual unannounced inspections that provide a valid probability sample of tobacco sales outlets accessible to minors. It also requires states to report their sampling methodology and results of the annual Signer survey as part of the annual Signer report no later than December 31st or at the end of each calendar year. This includes the state sampling methodology, Signer survey results, Signer inspection report, and the Signer inspection protocol. It also asks states to revise their methodology, inspection reports, and inspection protocols to include the revised age requirement, which is now under 21. In addition, the Signer survey results also must now include sales to youth and young adults under the age of 21. Again, the Signer regulation is requiring that each state reduce its retail violation rate of no more than 20%. Here in Hawaii, we have HRS 712-1258 that deals with tobacco enforcement. Under this law, it says that it's unlawful to sell or furnish a tobacco product in any shape or form or an electronic smoking device to a person under 21 years of age. Other requirements for retailers, IDs must be checked of those purchasing these products if they look younger than 27 years. And retailers might also have signs stating that sales to those under 21 are prohibited. And these must be posted around the store. If a person who violates this law or retailers and sells to underage youth, they will be fined $500 for the first offense, and subsequent offenses will increase the fines. For those who are under 21 who try to purchase and violate this law, they will be fined $10 for the first offense, and subsequent offenses will increase to $50 or are required to perform 48 to 72 hours of community service hours. However, This law does not apply if purchase occurs as part of a law enforcement activity or study authorized by the DOH to determine non-compliance rates, which is pretty much what we do in our 3 projects. And then just to give you guys a little bit more overview of the 3 tobacco enforcement projects here in Hawaii. Our first one is the annual signer survey. This was established way back in 1996. For this project, it is meant to or aim to develop a strategy and timeframe for achieving a violation rate of less than 20%. Again, as stated earlier, we are also required to submit an annual report detailing Hawaii's activities to enforce the law, overall success in the previous year, describe inspections and methods to identify outlets, and to plan for enforcement in the next fiscal year. To go along with the annual signer survey, we also have the Hawaii State Law Enforcement Operation, or Project CATS, which was established in 1997. This is again aimed to enforce law to reduce tobacco availability to underage youth by conducting compliance checks with undercover county police officers. So we do this all throughout the state with the different county police departments. And then in 2012, we started FDA tobacco compliance checks. Again, this is very similar to the first 2, in which we tried to determine retailers' compliance to laws and regulations, including the Federal Food, Drug, and Cosmetic, or FDNC Act. And then for across all 3 projects, we pretty much do very similar things, in which we do conduct tobacco compliance checks at all retail establishments that sell tobacco products in the state of Hawaii. We have underage volunteers who participate in these compliance checks by attempting to purchase tobacco products to determine retail noncompliance. And again, the overall goal for all 3 projects and for the entire state is to minimize noncompliance rate for underage tobacco sales. So who are involved? As mentioned before, so our main funders, or our main source of funding, comes from both SAMHSA and the FDA Center for Tobacco Products. They then contract the State of Hawaii Department of Health, who then gives it to the Alcohol and Drug Abuse Division, and then or ADAD, and then ADAD then subcontracts for their law enforcement operations, which is Project CATS. They subcontract to the different State of Hawaii County Police Departments, namely Honolulu, Hawaii, Kauai, and Maui counties, and the University of Hawaii Office of Public Health Studies, or OPHS, and we work hand in hand to conduct these law enforcement operations. In terms for the annual signer survey and the FDA tobacco compliance checks, since there is no law enforcement or police officers that are involved with these 2 projects, ADA then just directly subcontracts OPHS to do these inspections or compliance checks.
Okay, thank you, Nick. So I'll just talk to you a little bit about the annual signer survey report. So the signer project collects data for that annual report that Nick mentioned that's turned into SAMHSA every year on December 31st. And so for that, they survey, it's a survey of randomly selected stores in the state to conduct these compliance checks, with the goal having a retail violation rate of less than 20%. So the penalty, if we are not able to do that, is that Hawaii loses up to 10% of federal block grant funding, which puts millions of dollars at risk. So that's why we try really hard to keep it under that 20%. And then to do this, we have underage volunteers attempt to purchase tobacco products and then collect data at each of these establishments. And then these inspections are conducted with the OPHS staff. So before inspections are done, a list frame has to be developed first. And this was a database of all known tobacco retail outlets in Hawaii. So this includes outlets found on an FDA list, the police enforcement operations, signer inspections, retail tobacco permit list from the State Department of Taxation, the tobacco license list, as well as this electronic smoking device retailer registration certificate holder list. As of 2018, within the Attorney General's office, the ESD retail registration unit required a registration of all entities engaged in the sales of ESD. However, I believe this unit closed as of July of this year, but it still might be under the purview under the State of Department of Taxation. And then, so once that list frame was done, canvassing was also done of all the outlets that sold tobacco through visual examination and, if necessary, verbal confirmation. To ensure the accuracy of the list frame, matches were determined by comparing outlets on the list frame to the business name, address, outlet photos, and our GPS coordinates. And then once that list frame was compiled, we then had a sampling frame, which was, they took a random sample of that entire list frame. And so outlets in each county are selected proportional to the statewide sampling frame. The islands of Kaho'olawe and Ni'ihau are excluded from the sampling. And then there's this algorithm called the SINAR Survey Examination System version 7 that's provided by the Center for Substance Abuse Prevention, or CSAP, and that's used to calculate the sample size. And so for our data that we'll be presenting today from 2021 to 2022, there were 356 outlets randomly selected. However, like I mentioned, this is from 2021 to 2022 data. Not all outlets were included in that sample. So of the 356 in the original sample size, 15 or 4.2% were ineligible due to being out of business, not selling tobacco products, temporary closure, or they couldn't be located when the team went out to canvass. And then there were also 13 outlets, or 3.8%, that were eligible but not inspected. So this could mean that they were in operation but closed at the time of the visit, the tobacco was out of stock, or it was too costly to inspect. And when we say too costly to inspect, we mean that they were on Lanai and Molokai, making it too expensive to fly there to do the inspection. So this resulted with 328 outlets, or 92.1% of the original sample. So in addition for preparing the sample of outlets to inspect, the staff needs to be recruited and trained to go out and do these inspections. So in order to do this, all OPHS staff undergo a criminal background check. They must have a valid driver's license, motor vehicle registration, no fault insurance card, and attest to no moving violation in the past 3 years or problems with their personal vehicle. And the things that they're trained on include the purpose, why they're going out to do these compliance monitoring. What is the Hawaii law regarding underage tobacco sales? We review what the SINAR inspection protocol is, and we also role play the tobacco buying procedure. So the volunteers are comfortable out in the field when they have to do this. We emphasize avoiding misrepresentation of age. So if they're asked what their age is, they have to give their true age that they are. This is all confidential. We observe safety procedures to make sure that everyone is safe. And then we make sure that we go over and review and that they understand the data collection forms, as well as practicing and becoming proficient with the iPhone data collection app. So along with the recruitment of staff, underage volunteers between the ages of 15 and 20 years are also recruited via when our staff go out to do presentations at local high schools, for their health academies, youth clubs, university health fairs, university outreach, things like that. Volunteers are not paid, but they do receive small incentives and can log service hours. They participate, like I said, they participate in these compliance checks by inspecting a specified number of stores statewide, including neighbor islands. And sometimes using, saying that they're going to be inspecting neighbor islands is incentive enough for these volunteers to participate. And then they may be subpoenaed to court to testify as a witness. Okay, so this figure, it is a little bit older, but I just wanted to show you the history of the SINAR inspections from when they first started back in 1996. And you can see that when it first started, the non-compliance rate was at a high of 44.5%. And then once the the compliance check started, it slowly started decreasing. I mean, it kind of fluctuated, but it really kind of fluctuated between 4 to 6% in the last few years. And then if we look at data from 2022, we can see that there were 7 underage volunteers who went out for us to do attempted purchases. There were 4 male and 3 female volunteers. They attempted to purchase tobacco 328 times. Oh no, there was, sorry, 328, yeah, stores visited. And let's see, with 20 successful buys and a violation rate of 6.1%, which is well below the retailer violation rate set by the feds at 20%. And I know this is kind of small to see on this figure, but if you can see, starting in 2018, we started differentiating between the types of tobacco that was purchased. So there's cigarettes and cigars in the red line, and then the ends and the ends components in the green line. And that's kind of also been fluctuating a little bit. So monitoring needs to be continued as the rates, as I said, have been kind of going up and down. The sign-on report also shows the different characteristics of the volunteers and the types of tobacco products attempted to be bought and what was actually bought, and then what type of retail outlets were inspected and what types were sold to underage volunteers. So you can see right now in that first table, male to female and how old they were and who was able to purchase, successfully purchase tobacco. And then for the types of tobacco products, that's on the bottom left-hand figure. And then for the types of retail outlets, for attempted buys and successful buys, the most, I guess, attempted buys were at an other retailer, and successful buys were also at the highest at other retailer, and other represents outlets like specialty tobacco shops, like vape shops. Okay, go ahead, Nick.
All right, and then now I'm going to go ahead and talk about our second project, which is the law enforcement contract. Again, this is called Project CATS, or Cruising Against Tobacco Sales. Again, this was established back in 1997 in response to the Signer Amendment and Regulation. Again, the goal of this project is to reduce tobacco non-compliance rate. One really interesting part of it is that we do inspections with the county police departments or with police officers. So we work with the Honolulu, Hawaii, Kauai, and Maui police departments. Again, underage volunteers attempt to purchase tobacco products and collect data about each establishment that they do the purchase attempt. So the main difference between the law enforcement or Project CATS with the annual signer survey is that for Project CATS, we inspect all retail establishment with a tobacco permit throughout the entire state. However, for signer, we only randomly select a sample of establishments using the CSAP information that they provide us every year. Again, undercover police officers accompany our underage volunteers when they do the inspection. If there is a purchase or a violation, the police officer then issues a citation to the clerk, and the tobacco products are confiscated as evidence. So the data for our inspections are actually posted on the DOH ADAT website. So from 2008 to 2015, you can view the citations we're giving for clerks selling to those under 18 years of age. And then from 2016 to the present, you can see which stores were giving citations for selling for those who are under 21 years of age. And then here it is similar to the earlier graph for signer. So this is for Project CATS. As you can see, it started way back in 1997 with a sales rate of 18.1%. And then it went down with this most recent is in 2019 of just 6.1%. However, try to keep in mind that this is 6.1% of all tobacco establishments in the state are still selling to underage purchasers. And this is a little bit more breakdown of the different sales rate statewide, in the neighbor islands, and by counties from 2016 to 2022. However, if you could see, there is no data for 2021 because we did not have any enforcement operations in 2021 due to the COVID-19 pandemic. And then I'm just also going to quickly go over our third tobacco enforcement project, which is the FDA retail compliance contract. This is very much similar to the signer program in which there are no police officers that are inspected or we inspect with. We inspect the stores with FDA commissioned officers. However, we still try to inspect all retail establishments in the state that has a tobacco permit. However, the FDA is very confidential, and of all the data that we gather for them, as a matter of fact, all data that we collect during FDA compliance checks are sent directly to the FDA for processing. However, we do have some information for you guys if you guys are interested. The FDA has this website where they provide information of the different data and information that we gather from our tobacco compliance checks.
Yeah.
And then if you are interested in furthermore reading about the Starner Safe survey, the state does publish the annual sign-up report. This is the link for the latest one, which is for the federal fiscal year 2023. And as I said earlier, the DOH ADAT also publishes online our inspection results and from 2008 to the present. And this is the website for it. All right, well, thank you very much for listening to our presentation. If you also would like, or if you know anyone who might be interested in volunteering for our projects, or know anyone who's interested between the ages of 15 to 20, you can refer them to us. We have our contact information, we have our email and our office phone number listed here as well. Thank you.
Thank you so much for your time. Okay, I am gonna stop sharing and open it up to questions. And if you don't have any questions, you can also just email us if you think of something later on in the future.
Thank you.
Thank you.
Yes, thank you so much, Kara, Nicholas. Any questions? Just send them through the Q&A feature, Zoom chat, or you can also raise your hand. Okay, if no questions, thank you so much to our speakers for the great presentations. We're now going to move on to closing remarks. If you have any ideas for future speakers who would be willing to share data related to substance use, please let us know by sending us an email at m4c+SCOW@hawaii.edu. We would be more than happy to reach out to anyone you think would be a good fit. We also have a QR code and quick link to access our SCOW YouTube channel where the meeting will be posted. And we would like to ask everyone to please fill out our brief post-webinar survey that'll pop up once you exit the Zoom room. We greatly appreciate your feedback on the meeting. And that concludes our SCOW quarterly meeting for November 2023. We'll see you again at our next meeting. Thank you so much, everyone.